date with information, but far more important that you take regular breaks. So go outside if it's safe to do so. Go into your garden and do some gardening if it's safe to do so, or something else that you enjoy doing. Recognise that there are only 1 or 2 hours in the day that you will allow yourself to update with the news, scrolling on your phone. Outside of that, you need to think about other things than the coronavirus. It may feel like you're losing control with your mental health, but you can take back control by having a clear structure to your day and allowing worry only at certain times.
Some tips there from Dr. Amir Khan on practicing self-care during this time. The coronavirus pandemic has plunged the entire world into a state of uncertainty that is taking a toll on people with existing mental health conditions. And as millions face sickness, isolation, financial hardship, and information overload, it is likely to trigger a whole new crisis. I'm Femi Oke, and today on the stream, we will assess the impact of the coronavirus on our mental health. You can send your questions, your comments, your concerns via YouTube for our expert panel.
People who experience anxiety, depression, forms of trauma may notice that their symptoms increase, especially because there is more social isolation, routines are being disrupted, and maybe there isn't as much motivation to take care of oneself or engage in basic self-care.
There are so many downstream effects that we're seeing right now because of the COVID-19 pandemic. And from a psychiatrist standpoint, I think about the fact that on inpatient units, we can't have group therapy for our patients because of social distancing and keeping them safe while there, but then that limits the effectiveness of the therapeutic milieu.
Longer periods of isolation can have a strong impact on mental health, causing emotional diseases like anxiety, depression, irritability, or sleeping disorders or symptoms of post-traumatic stress disorder. But at the same time, the situation can give the chance to rethink our relationship with time, with passions, and with the strong values.
Some valuable insights from 3 mental health experts. Joining us now on the programme, we have Dr. Jose Luis Ayuso-Mateos. He is the Director of the World Health Organization's Collaborative Centre for Mental Health Services, Research and Training at the University Autónoma of Madrid. He's also the Chairman of the Department of Psychiatry at La Princesa University Hospital in Madrid. In London, Andreas Kappas is a social psychologist and a neuroscientist. He's also a lecturer at City University of London. And in Mumbai, Mihira Desai is a clinical psychologist and co-author of the book, The Coronavirus, What You Need to Know About the Global Pandemic. Thank you all for being here as we tackle such an important issue. Mihira, Andreas, Jose, the moment that I told our audience what we were going to be talking about, I'm just saying, watch the show in a few minutes' time. This is the kind of reaction that I got. So Matt Dean says here on Twitter, everything is disorientating right now, including something simple like the passage of time. It's hard to know what to feel or what one should feel. And then one more, just a reaction to us talking about this today. Steve is in the UK. He says, I think we're all going to be different after this, the longer it goes on, if you know what I mean. Mihira, do you know what Steve means?
Absolutely. Femi, thanks for having me on the show to begin with. I feel the world has never seen a crisis like this before. The virus is still unknown in many ways to all of us, and we're discovering more about it. But the impact it's having and the spread is calling for drastic measures across the world. And a lot of places, including in India, we're under lockdown. And people know that from one side to the other of this, things are going to be different, and it's up to us how we come together, not physically, but socially, to fight this. So yes, it's not going to be the same.
All 3 of you are in lockdown situations. So let me go to Andreas. Andreas, what are the kind of stories that you're seeing where people are exhibiting stresses in terms of their mental health? Just give us one example.
Well, I think I today talked with a student, and she is an international student. and she's wondering whether she should go home and to see her parents or continue her studies. She's afraid that if she goes home, she has to stay 14 days in quarantine. So that's very unpleasant. But if she stays in London, then she doesn't know if her elderly parents get sick. Can she reach them in time? Can she help them and support them? So I think they're very new, very unusual decisions where we don't really have a clear strategy what we should do or should not do based on our past behavior. So I think we face uncertainty and we face really a lot of difficult situations and decisions at the moment.
What do you do about that in your professional approach to how people are feeling mentally? Because this is something that you've trained for many years for, you've done the research for, and now this is a whole new situation. Jose, you go first. What do you do?
Speaking about there was different voices that we hear before about some of the challenges that it means for mental health care, and then that's my major concern now. How can we organize still providing mental health to our patients, to all the people we normally attend on an outpatient way, or as was mentioned before, as a group therapy and things like that. And now you have to remember that this lockdown also restrict all non-essential movements within the city and within the country, and that also affects the ability to see your provider, to see your psychiatrist, to psychologist, to attend the day hospital, even to go to the emergency room of the general hospitals that now are focused on the care of patients that may or that have the coronavirus. So we need to completely change the way we provide care, but at the same time make this care available for patients. So that's why we in Madrid, in the situation we are now, in 10 days, we have to shift all our activities, which were based mainly of people being present and in contact, human contact with the mental health care providers. Everything has been moved into telemedicine, phone conversations, social media contacts, because we need to be in contact with the patients, but at the same time, we have to make sure that they restrict as much as possible when they go out, even to see their doctors. And that's something which is very challenging, but it can be made, and luckily we are in a society now is as much connected as
Jose, you make some multiple excellent points there, and I also want to bring in our YouTube audience because they are feeling anxious, to say the least. We have M. Cello on YouTube. And M. Cello is explaining, during the first 2 weeks of quarantine, I found it difficult to concentrate, to read a book or do anything. I could only follow the news and I was very distracted. Is this normal? I don't want to start doing a stream therapy session, but Mahira, do you want to take that one on first of all? And then Andreas, you can jump in afterwards. Go ahead, Mahira.
Absolutely. It is normal. Let me be honest. I'm a healthcare professional. It's day one of lockdown here. We have 20 more days to go. And if you ask me, am I fearful? Yes, I am. Am I worried? Yes, I am. So for any person who is worried out there, it's an absolutely understandable situation. It's a new situation altogether. The question is, how do we cope through this? I feel it's at 3 levels. One is to get our nerves under control. We need to be responding rather than reacting to the situation.
All right, Mahira, I'm just going to ask you how, because it's easy to say it, not necessarily easy to control it.
Absolutely. So where does the anxiety and the fear come from? One, it's a lack of knowledge, I feel. Everyone's worried, am I going to contract this? How is this going to change my life in the future? If we are aware how to keep ourselves safe, I feel that knowledge in itself is very empowering. Additionally, breathing exercises in India, yoga can be very helpful, and restricting, like Dr. Amir had said earlier, restricting your screen time and the amount of information you get can be key in the process.
Yeah, if I can just jump in, I totally agree. I think one thing we kind of forget a little bit, that most of us probably will be fine. I think we're in a situation where we're kind of adapt to the new. It's a weird situation. Everything is new. Our past behaviors don't really work anymore. We have to find ways. But if we look at the research at earthquakes, at 9/11, at any other catastrophic event in the past, most of the people will be fine. So I think I don't want to downplay kind of just like, it will be, for some people, it will be tough, especially if you have some kind of pre-existing conditions or vulnerabilities. And I think we have to figure out how we can take care of these people and how we can reach them. But just if you have not a history of any like a mental disorder, you will probably be fine. You will experience a phase of change, a phase of uncertainty and anxiety, but you will get adapted to that. And I think we shouldn't kind of forget that the majority of us will be fine. And if I just look at the researcher, if I look at the people here around me in South London, they're remarkably calm and just going on with their business. And my students, most of them, are doing very fine too. Yeah. So I think, of course, there's for people who are with some pre-existing conditions, this could be really worse in that situation. Yeah. But most of us, I think, will be fine.
That's good. That's very reassuring. Let me just bring in this, because you mentioned people with pre-existing conditions. This whole situation must be quite triggering for many of them. Looking here for NBC News, we're talking about, and this, Dr. Jose, I'm going to put this to you. Coronavirus is a personal nightmare for people with OCD and anxiety disorders. The idea of having to wash your hands, don't touch this, don't take your shoes off, take this off, change your clothes, all of that. That sounds like we've all got OCD all of a sudden. What about if you've already got an existing condition? Where are you going to go to for help?
Well, we know that in these circumstances, the people that are more vulnerable to have some mental health issues and problems are the ones that are already have one and that have been in contact with the health services or not. And in particular, you mentioned the patients with obsessive compulsive disorders, that the whole effort of the therapy has been trying to control this behavior, and now the public health measure that is universally administered is you should clean your hands as much as possible. Yeah. And after you touch something, so it is a challenge for them. Mm-hmm. It is clear, but I mean the main issue for me here is that, as was mentioned for one of our colleagues before, that most of the people will recover. It is true. We are in a new situation in terms of the specific of this epidemic, but humanity has been in the past under a lot of stressful circumstances, and we know about the resilience of the population. Okay. So most of them will recover, but there are people with vulnerabilities, and we need to take care of them in these times of crisis. Indeed. Because this will take an impact later on.
If I could just jump in and say one more thing, I think there are people with vulnerabilities. The other group of people I'm kind of concerned about is people who are basically at the front line, who are here in the UK, who are working for the National Health Service. I think we have some data from past research of
Dr. Andreas,
people
can I just ask you something absolutely directly that's coming on YouTube? As you were saying, I'm concerned about the front line. This is coming in on YouTube absolutely live, and you can just answer it from Lauren. Lauren says, any suggestions on how to manage your mental health when you are a frontline worker? You cannot escape the pandemic when it is literally your job to be surrounded and deal with it every day. Dr. Andreas, you were absolutely going there, so go ahead and answer Lauren's question.
Okay, so what I actually wanted to say is that I think that's a group of people we should be concerned about, because before, and I said most of us will be fine, but I think if you look at kind of research and tracking how the people that were at the front line fighting SARS in South Korea dealt with it, there was about 20 to 25% who had a year later still post-traumatic stress symptoms and heightened anxiety and depression. So I think just as all the things we do for people who have some certain vulnerability, I think we need to kind of realize that these are people that are under immense stress in a very difficult situation. They might even be much more isolated from their families because they can't go home because of they have to isolate after work. So I think it's a really difficult situation. We have to kind of think about how we as a society or as a government or as a healthcare provider can give them special help. Yeah.
Let me jump in. Yes, I mean we are that is a very big issue now. I mean the issue about the people are on the front line. I mean the nurses, the doctors, all the staff working in the units, and they are under a lot of stress. To add some of the stressful circumstances is the stigma that is also affecting those professionals working with patients with the coronavirus. And then another thing is that it's a highly infectious disease. So and in the situation in Spain, 12% of all infected in Spain are healthcare workers. That's a huge number. There's a huge percentage, and that's of course one of the main issues of concerns. And of course, it's a very stressful situation because some of the patients get sick very, very, very fast, and they need to go to an intensive care unit, and of course that's very stressful.
So
but
doctors,
in addition.
If I may, I hate to interrupt you because you all have beautiful calming voices and beautiful calming suggestions as well. But I want to just push it ahead and talk about coping strategies. So the Stream Digital team wanted to see how much technology, maybe like tele-apps and games, might be able to help us keep connected while we're forced to stay apart. And this is what we found. Have a look. Mood tracker apps like Samvelo are now offering premium services for free. This was a direct response to users' mentions of COVID-19 and coronavirus, spiking 500% since mid-January. Video game fans know playing online is a sure way of connecting socially with mates from a distance. They're sharing their coronavirus must-play lists. And we've seen signs that gamers are living their best quarantine life online. All right, you're finally vindicated, gamers. You can spend hours online. No one's going to tell you off. All right, so we asked our online audience, are you using apps to cope with stress and anxiety from the coronavirus outbreak? We've got some interesting responses. So from Adanasi, Youper has been a great app for me since the outbreak and lockdown in my country. It brought my thoughts together, feeling calm and relaxed at this time of a world deadly pandemic. And this is what Youper looks like, your emotional health assistant. One more from online. TJ says, Talk Life app is one global community that gives one the needed help. They don't judge, they just give support and compare to other mental health apps. And then this is there. You're not alone. Let's talk. Mahira, I'm just wondering if the idea of traditional therapy, of sitting there one-on-one, is that now being superseded by what people can have to outreach and do in other ways, because you can't sit next to anybody right now. You're in isolation.
Yes, it is. In fact,
yes.
I'm going to start with Dr. Jose. I'm going to start with Mahira first, and then you can pick up after her. Mahira, go ahead.
Yes, it absolutely is, because looking here back in India as well, I am working out of home now. So all my counseling services that I offer is via the internet. Not just that, I feel there's a very big distinction. What we are seeing is a surge of wellness programs, and that is more a preventive measure which helps you from getting into a mental health trap. On the other hand, what we are seeing and is gaining a lot of success are online chats. In India especially, there is a lot of stigma regarding mental health concerns, and anonymously people are being able to access this. Over the past few years, we have been seeing these resources and usage grow. And now I feel that this pandemic, with the demand supply being so different, it's going to completely take over. In fact, artificial intelligence is also being brought in. We have apps like Visa, because the number of healthcare providers will not be able to take care of the supply that is, the demand that is out there.
Sure.
So the supply can't meet it. So artificial intelligence, I think, is here to stay. And it's being used not just to innovate and find solutions with treatment, but also to help people with their mental status.
So just one warning here before I go back to Jose. Tamoy here on Twitter says, many tech tools will pop up now to capitalize on the largest collective meltdown in human history. His term, not mine. Check privacy and data use terms thoroughly. Don't fall for the exorbitant claims. No app can replace a trained human. Watch out for the mental health equivalent of Galmutra. So this is a warning here, Jose. Your thoughts?
Well, I just to remind you that social distance is a physical distance, but of course we should encourage those that are having a difficult situation to talk to someone when possible, talk to someone they trust. And in fact, in our hospital, we just established a 24-hour line for those health staff that are under stress, that they can talk to someone anonymously within our department over the phone. And this is extremely useful, and I think that's one of the things that we have to highlight. The same that are under similar stressful situation in quarantine. I mean, apps can be a help, but I think that when you can talk to someone, when you can have a human voice on the other side, that it will be much more helpful.
Got it. I would love to just get a coping strategy from each of you. And Dr. Andreas, if I can share this with you, just very briefly, the WHO, the World Health Organization, are giving people advice for all sorts of details about the coronavirus, but they're also telling you to be safe, be smart, and this is really interesting down here, be kind and support each other. They know that mental health is going to be very important. Dr. Andreas, if you had to leave our audience with something that was very helpful that would help them cope, you said most of us are going to be okay. What would it be?
I think if you kind of look at back what helped the medical or the doctors in South Korea who were at the front line and coped best with the disease, what they seem to have is kind of like an altruistic, a pro-social framework where they think, okay, I'm washing my hands to help somebody else. I'm here out on that would be an example where we could frame it. The doctors are thinking, okay, I'm risking my life, but I'm doing it for the greater good to help others. And people who adopted this more kind of pro-social framework, who did not look about their own safety, did not worry too much about their own status, but kind of looked in, what can I do? How can I contribute? How can I see my actions in the greater framework? How can I be kind of perceived that I'm this little yet important and significant part in fighting the disease? If you have a mental framework like that, if you kind of go away from yourself and think about others, this will be a real protective framework. And I think that's something that people can do, try to shift the way we look at our own problems and kind of see them in a greater framework and see like, okay, we are doing, by staying home, by washing our hands, by isolating, we're doing something good for humanity. And I think that's the framework we should need to embrace in our daily life.
Dr. Mahiri, if you had one sentence of advice, one short sentence of advice, what would it be?
What I would say is that there's a lot of stigma around it. People are afraid, they are fearful, they have half knowledge, negative beliefs. What I would encourage is put yourself in the shoes of somebody who is suffering, who may be a suspected or confirmed case. Don't let your fear and your anxiety take over the compassion that you can provide in these situations. Please behave with others with the same support that you would like.
You can tell why she wrote a book about the coronavirus. Thank you so much, Dr. Mahiri. I really appreciate your one sentence of pithy advice. We will come back to you for more, I'm sure, during the coronavirus crisis. Let me just show you what our audience online are doing to help themselves. I like Victor. He's watching a lot of jokes, spending time and enlightening others. I hope they feel the same way, Victor. Dorothy Wright, she's reading, music, cooking, talking on the telephone. And Peter's stay-at-home Dobby is in the gym. He's watching movies. He's revisiting favourite TV. Doctors Jose, Andreas, Dr. Mahira, thank you so much. And if you still have questions, look here on my laptop. The next episode of The Stream, we will be asking your questions about coronavirus from sub-Saharan Africa.